University, he's an associate professor of global health and medicine and a core faculty member of the Duke Margolis Institute for Health Policy. Dr. Uday Kumar chairs Duke's Global Priorities Committee and has published in top journals like the New England Journal of Medicine and Health Affairs. And with that, Dr. Uday Kumar, I'll turn it over to you.
Thank you so much, Dr. Cheng, and such a pleasure to be able to join you and this whole community today. As you've already heard, I'm the moderator for this conversation. We've got three fantastic speakers that will each have about 8 to 10 minutes to provide their opening remarks, and then we'll have a robust conversation around many of the topics that are driving certainly the future of the field of public health, but also the future of the economy and of society more broadly. So I'll introduce all three of them briefly up front, and then we'll go into their presentations. Please feel free to send questions using the Q&A opportunity through Zoom, and we will make sure we incorporate questions from the audience as we go. We know that this is an incredibly important topic and one that many people are interested in, so we will try to make sure we keep the conversation moving and incorporate as many of the questions we get as we can. First, we're going to hear from Nicole Turner-Lee. Dr. Turner-Lee is a senior fellow at the Brookings Institution and is director of its Center for Technology Innovation. She's a leading voice on equitable tech access and AI bias and founder of the AI Equity Lab. Dr. Turner-Lee frequently advises policymakers and global institutions, and her work bridges research, advocacy, and public policy to ensure that technology serves all communities. Second, we'll hear from Suresh Venkatasubramanian. Suresh directs the Center for Technological Responsibility, Reimagination, and Redesign with the Data Science Institute at Brown University, where he's a professor of computer science and data science. His background is as a computer scientist, and his current research interests lie in algorithmic fairness and more generally the impact of automated decision-making systems in society. And after that, we'll hear from Kay Firth Butterfield, who is CEO of the Good Tech Advisory. As a global leader in responsible AI, she was the world's first chief AI ethics officer and formerly led AI and quantum initiatives at the World Economic Forum. A Time 100 Impact Awardee and Forbes 50 over 50 honoree, Kay advises international organizations on AI governance and ethics. We have a wonderful conversation coming up, and I'd like to invite Nicole Turner-Lee to get us started, please.
Here I am. Well, first and foremost, thank you so much, Krishna, for that invitation. And to all of you and who are part of this esteemed lecture series, I would like to say that I am humbled to present before you. I'd also like to say that the AI Equity Lab, just for people who are wondering what that is, we are a lab that's focused on interdisciplinary, cross-sector civil society engagement in ways in which we are creating purposeful, pragmatic, and non-discriminatory AI. So I could talk more about it in the Q&A, but that's a pet project that I've had for some time. I'm also going to share some slides, but before I do, I also want to just suggest that I wrote this beautiful book as well, Digitally Invisible: How the Internet is Creating the New Underclass, that came out last year. And in my presentation, I'm actually going to reference a story because there's a bunch of stories about people who are not connected to the internet, but one which is very relevant to this conversation on AI and healthcare. So I'm going to take a few moments and I'm just going to share my screen, if you all don't mind, because I want to make sure as we go into this conversation that we do some level setting, because you're going to hear from my esteemed colleagues, all of us, which probably have different perspectives on the same topic. So let me get started. So first and foremost, I want to make sure before I start my remarks and perhaps some level setting before we actually do this conversation today, that we're talking about an ecology of AI. Obviously, there's artificial intelligence, which as you see is the big bubble. It not only includes a lot of what we're talking about today in terms of algorithms, but it also has autonomous vehicles and other autonomous mechanisms and devices and software applications. Machine learning is essentially the computational engine behind AI in terms of the automation of repetitive tasks. There's deep learning, which actually permits much more invasive, I guess, technology scraping when it comes to speech, facial recognition, image, emotion. And then obviously a buzzword that most of us have been hearing about and talking about is generative AI, which relies upon what is mostly considered the eyes on the back of your head, meaning publicly curated internet content that is actually feeding into large language models, which permit predictive, summative, and now agentic, more autonomous outputs. And so I want to frame that because I think it's really important for the purpose of my talk to talk about AI in healthcare so that you understand how these systems work. In particular, my research looks at bias and bias mitigation. And I want to continue, now that you have a general level setting of AI, to talk about how I frame the introduction of bias in algorithms or any AI system. Bias can be introduced when it comes to the design of the problem. Who sits at the table matters, particularly with AI in healthcare. If there are no health practitioners or very few patient advocates or people who are in pharmaceutical innovation, for example, the design of the algorithm normally suffers, or the AI model suffers, because it defines and designs those products and services and computations in ways that may not be inclusive of impacted groups. Bias also shows up in the training data, the data that is actually teaching the machine on how to learn the predictive or summative or generative experiences of impacted groups or populations that are the subject of the AI. There are trade-offs that we make. One, because much of the data that comes from AI systems comes from the public internet in many respects, or data sets that's been curated for commercial entities, and they come with human prejudices, over or underrepresentation. And I'm going to talk about in a moment how this is so important in healthcare. And I call this training data that often comes traumatized, meaning it's based on the historical and the systemic inequalities that show up. Now, how that's related to healthcare, just think about it for a moment. We already know, in terms of the representation and training data, that Black and Latino patients, for example, are underrepresented in clinical trials. So essentially, that training data represents those marks of inequality that then impact that last bucket, which are the results. Meaning, how groups are affected by AI often tends to happen based on the representation in those training and data infrastructure. So I shared with you a little earlier, I wanted to go back to my book for the sake of time. I want to come to this example. There was a woman that I met in a public library who I was talking about library access and how we give broadband to people who do not have computers at home. And she was basically struggling to get a library card. She was at the point of tears with the librarian. I followed her out of the institution and asked her, why she was looking for a library card, only to find out that she had stage 4 breast cancer and she needed a library card because that was the only way for her to look at her doctor's records. Think about it. Just a couple of years ago, a person needing a library card to look up private patient data. Someone asked me on a panel if this young woman, who again was a mother of 3, her name was Frances, by the way, had AI actually help her throughout the course of her diagnosis, would we have discovered it much earlier in its maturation? And I had to tell them probably not, because people like Frances, people like me, Black women are underrepresented when it comes to breast cancer diagnosis because of the density of our breasts, or more importantly, because of the fact that we don't participate as often in clinical trials. So I share that with you all because we have this ecology that is still baked with bias. And it's important that we understand that that can have adverse effects on various populations, which in the application of AI in healthcare means a lot. It is a fine line between whether or not a person like Frances will stay alive or will live a life where she's not able to have the quality of care that is needed. This is important because over the last couple of years, we have seen AI in healthcare show up in a variety of areas. And I just listed 3 for the sake of time. Clinical trials, and of course, let me not be total Debbie Downer with this. There are some parts of healthcare where clinical trials are more represented. I just was on a panel just Friday with the Association of Black Cardiologists, where one of the esteemed doctors basically said that in cardiology and imaging screening, we just do a better job when it comes to AI because we have beta tests that we're able to look at based on the fact that more people are engaged in this type of interventionist activity. But there are cons based on who's harvesting that data, where that data is being taken. There are community health clinics that have less sophisticated radiology equipment where the image may be more grainy. Friends, it shows up in healthcare and clinical trials. We also know that it shows up when it comes to algorithms and data sets, which I basically just shared, where we're not accounting for the representation of various groups. And then one area that I work on a lot is in health equity research. While AI in healthcare can allow us to get to granularity when it comes to social determinants of health, for example, being able to understand why there's a propensity of one disease over the other in particular communities. What it also does, it's bias. It may not take into consideration some external attributes. One of my colleagues wrote a really nice paper during the pandemic that suggested that more people of color were dying, not necessarily because they were only medically underserved, but because they lived in dense housing conditions, or they lived in areas that were deserts when it came to hospitalization or care, and their use of the emergency room and their distrust of the medical system actually limited them. If you're not understanding it by now, as I get ready to close in just 2 minutes, what I'm suggesting to you is that there are breakthroughs in AI when we think about how it's going to influence the healthcare space. Much of that is going to go down to whether or not we continue to interrogate AI for what it's worth. Is it demonstrating effectiveness? Does it have situational consciousness? Does it work, like I said, in radiology the same way it does in gastroenterology? Are there ways in which we have to ensure that second bullet, that it's unbiased and equitable, and that it can potentially surpass any trade-offs that we may be making simply because we don't have enough data or we don't have enough research on that space? And who do holds accountable? Who do we hold accountable when things go wrong? I'm always reminded when I think about AI in healthcare, a young woman by the name of Henrietta Lacks, and what happened with her, where we were able to harvest her DNA for some of the greatest of breakthroughs. But she died sick and poor simply because no one was accountable for that type of cell harvesting that contribute to the greater good. In the end, what I would suggest are 4 things as I wrap up my comments. As you can see, I'm very passionate about this. I probably could go over my time, but I'm going to tell Christian I'm not. I'm actually timing myself as I'm speaking. First and foremost, in the healthcare space, as we think about AI, let's always consider who is digitally invisible. Remember that book I told you about? It applies here too. And who on your team represents the interests or the lived experiences, whether that's their expertise in expert matter, subject matter expertise, whether it's a community that's not represented. Make sure that's part of the conversation. Always examine the quality of inputs. We know AI is going to be a big it factor as we see less people going into public health, shortages in nursing and doctors, and we may need to rely upon AI to help us get through those types of shortages. But they're done with trade-offs on shiny objects and products and services that still create chaos and consequence if they're not properly trained or they're not having transparency with the communities that are impacted. Building accountability with these systems, obviously, that's very critical. I'm sure we'll talk about it on the panel. And always embed any use of AI, particularly in healthcare, with responsible privacy, fairness, and equity. I'm going to close here because I think this is the last important thing to say. We do not want to use AI in ways in which we widen the gap of health disparities. And so it's incumbent upon all of us as we think about the innovation of healthcare to be mindful of how these impacts really affect everyday patients who may not understand how this technology could actually help to extend their well-being, or physicians who may not understand that in the efficiency of being able to use an AI tool to transcribe notes, that we may actually be missing something. There was a recent article about that in the New York Times. So thank you very much. I look forward to the panel and the conversation. But again, let's have a conversation today about this as part of the Bicknell lecture, as this has infiltrated this sector.
That's wonderful. Thank you so much, Nicole. What a great way to kickstart this conversation. Thank you so much for reviewing that ecology of AI, really to ground us in the right terminology, reviewing really the sources of bias and ways that we might actually start to combat it. So I'm sure there's going to be much more to talk about in the pieces that you've already laid out for us. To help build on that, let me welcome Suresh to this conversation and hear about the work that he is doing.
Thank you very much, Krishna, and thank you to Boston University and the School of Public Health and the Center for Health Data Science for having me. I'm delighted to be here today, and I also have a short presentation that I will share right now. So what I'd like to talk about is what I'm seeing now as we move from the kind of ML systems that Nicole talked about to these generative AI systems that we're seeing right now in the world. For many years, we've had these systems in play. We've heard of many issues associated with these systems. We've heard about the ways in which AI can introduce racial bias when managing health. We've seen algorithms being used to deny people access to care, Medicaid programs, and so on because of lack of transparency. We've seen technological sort of challenges with using computer vision to detect, for example, melanomas. And we've had people, in fact, some colleagues of mine at Brown working on better pulse oximeters that can be better calibrated to skin color when trying to detect oxygen levels, especially during COVID. We've seen all this happen. We've had many years to understand this, and as Nicole said, we have a fairly decent idea of how to evaluate and mitigate the problems associated with AI deployments. And I think of this as a triangle. We found ways to frame the questions we're concerned about in terms of health equity, in terms of disparities, in terms of transparency and accountability. We've found ways to measure and assess the degree to which the systems we're deploying have problems. And we've come up with tools and interventions that allow us to mitigate some of the worst effects of these systems. Not completely remove them, but definitely remove most of the worst effects and therefore get the benefits. And I think of this as sort of having sensors. That's a picture of a nuclear control panel in a plant with a bunch of sensors on it that tell us where things might be going wrong. Think of your car dashboard that lights up when things are turning out to be a problem. And then we have ways to fix the problem. If your gas indicator goes off, you got to go to the gas station, fill up gas. So we understand how to do a lot of that with the systems in play that we've seen deployed in the medical field, in public health, and in so many other sectors. But of course, with ChatGPT and with generative AI, things have changed. And we seem to have moved away from a sort of a Swiss Army knife model of the world, where we have specific tools for specific problems that we want to build interventions for to mitigate problems with, to a single sledgehammer that purports to do everything we want, right? Whether it's ChatGPT or Gemini or Perplexity or Llama or Qwen or DeepSeek or any of these systems. Or Claude, we just want one tool, or we seem to be given one tool to do everything. And the problem is, and this is a problem that is well known within the community of scholars studying these systems, is that once you do that, we don't know how to evaluate them. I mean, I joke a little bit, but a lot of the evaluation of generative AI systems, the kinds we're seeing deployed right now, are basically what the kids today would call just vibing. It seems to work well. We hold across our fingers and hope for the best. We don't have any good understanding of how these systems work in the field where they're being deployed, which is kind of scary when you think about the rapid rate of deployment of general purpose AI systems. And if you don't believe me, there's actually a bunch of papers now that have been talking about this, that have been sort of pointing out over and over and over again that evaluation of AI systems, modern Gen AI systems that are being used now as sledgehammers in so many sectors, including in healthcare and in public health, we just lack the understanding of where they work and where they don't work. Now, this is a problem. The current administration has, a key part of its plan is deploying AI in a variety of sectors, including in healthcare. And it identifies that, distrust or lack of understanding is holding us back in terms of deploying it. And so we want to be able to deploy systems that we can trust, that behave in ways that are appropriate and meet our expectations in the way we've had to work with systems in the past. So how do we get back to what we need? This idea that we can frame the problems that we care about, we can measure and assess carefully, and we can build in tools and interventions to do what we need. And so the thing I want to talk about a little bit is, sort of a thing that I feel very strongly about that is becoming more and more of an issue with Gen AI systems, that we need to empower the people who actually work in the domains where we're deploying AI to do the work of measuring, evaluating, and framing. And so this is, part of this is work that we're doing here at Brown, based on a talk we just gave. We were asked for hot takes, and I'm always susceptible to giving hot takes on things, and this was one of them. That basically what we want to talk about is, how do we bring communities and stakeholders into the process of evaluating AI systems in a way that we used to do and we no longer appear to be doing with the sledgehammer approach? And so what do we mean by a community-driven LLM evaluation? What it means is that we want contextualized and specific evaluation teams that are not just researchers, not just developers, not just people at the big AI firms, but people in the spaces where these tools are going to be used, right? Because they have the domain expertise and who take the lead in decision making. This is really important because the people in the domains know how to evaluate systems for specific concerns they have. They know what problems they care about. They know how to frame them. They know how to measure them, and they know what mitigation looks like. Developers and even researchers don't. And this is the kind of thing that we frankly don't do enough of. We do even less of now, and we need to do much more of. There's been a number of examples of this working out. We've seen this happen, for example, for evaluating the quality of chatbots for providing information about elections. We've seen this to evaluate the quality of large language models to get reliable legal information. We've seen this being done to evaluate whether these chatbots are good at summarizing scientific papers for journalists, and so on. The short answer is that they don't really work that well. And that's why, but the fact that these studies have been done with community partners, with people who have expertise in the area, has revealed exactly where they fail and exactly where they might work well. And again, so there's been a lot of calls for doing this, why AI evals need to reflect the real world. And so this is something we're beginning to move towards. And I think it's important to sort of focus our efforts and our thinking around how we can do this in different settings. And I want to say why this is important, not just for all the reasons I mentioned, to make sure we are bringing people in who are impacted by these systems and who actually have the judgment to evaluate these systems well, is because it actually yields good science. It strips away a lot of the marketing and the hype that we're confronted with when dealing with AI right now. It reveals not just a binary of AI good or AI bad, which I think is not helpful here, but reveals where using AI tools might add value and where they might not, right? To get a more nuanced discussion going. It allows a meaningful interaction among stakeholders. Instead of saying, trust us, we're the technologists, we'll tell you what you need. It actually opens up a good dialogue. It actually improves evaluation processes. And it shifts the focus towards people who are impacted by these AI systems and are using them. And this is where you start being able to properly answer questions like who's getting the benefits, who's not getting the benefits, where the disparity is coming from, and so on. Again, there have been calls for this over and over again. Colleagues of mine at Cornell have been looking at this. I've worked on this as well in other contexts. This is something that's beginning to be much more of a concern and an issue for how we do AI deployments. And we cannot go forward with proper trusted deployments unless we can find a way to bring communities of practice of expertise into the very design and evaluation process. And so that's what I want to leave you with as a thought, right? How do we go back from the sledgehammer towards a Swiss Army knife that was actually more effective for evaluating, measuring, and mitigating the problems associated with AI tools so we can actually get their benefits through community-driven evaluation. So I thank you for your time, and I look forward to the discussion.
Thanks very much, Suraj. Fantastic to hear about the work you're doing and great way to think about this. How do you frame the problem? How do you make sure that there's a way to assess it? And then what are the right interventions and making sure it's not a one-size-fits-all approach to doing that. Thanks also for introducing the importance of the community and community-based approaches, and also this idea of how we think about evaluation and the questions we ask being really important to make sure we're driving the field forward in an effective way. So again, much more to unpack as we get into the conversation shortly. Thanks very much for setting that up. And for our final speaker, let me welcome Kate Firth Butterfield. The field is yours.
Thank you. Thank you very much. And it's an absolute pleasure to be here with you today. I am following very much Nicole and Suresh, and I'm really pleased that we had this opportunity of them going first and me following up. I am going to share my PowerPoint, I hope. And then we can go from there, from the beginning. Yes, there we are. So what I want to do today is sort of follow up and really widen the aperture a little bit, but really focus on AI and health. I spend my entire life talking to companies, including healthcare companies and hospitals, about how to use AI wisely or responsibly in their businesses. And as Suresh said, there's so much hype out there. So my invitation to you today is one, that we think deeply about the role of AI, the human spirit, and the living planet. I think as healthcare professionals, that's very much within our remit, and it's what makes us human to human so important. I want to invite you to develop a clear-eyed understanding of the responsibility that we bear when we use AI. I want us to open up a space for each of us to wrestle with this profound question of how intelligence, human and AI, will shape every stage of our forthcoming lives and those who come after us. And I want us to join a conversation together. I think it's so important that we co-author the future that we want to hand to our families, our societies, and to the earth itself. So at the moment, it just feels as if we're running so fast to give away our humanity. All the jobs that we do, oh, AI could do that. So I'm a former judge, and everybody says, oh, AI could do that. But actually, my response is, well, maybe, but at least and yes, I have biases. Obviously, I do. I'm a human being. But at least I can explain my judgment. Whereas, as Suresh pointed out, if it's an AI judge, it can't explain its judgment because we have this lack of transparency. I believe that we should not be so eager to divest to AI of the things that make us human. And there are some studies now beginning to come out that show that actually we are not necessarily improving our intellect or improving our society when we use AI. But first, I want us to think about, well, what do our patients think about AI? When we're using artificial intelligence, what are they thinking? Well, only 95% of people, so it's a bigger number than last year, which is only 57% of people, had heard at least a bit about AI. They obviously hadn't heard anything of what Nicole told us. 50% of those said that they were more concerned than excited about AI. 57% rated the societal risks as high, and only 25% the benefits as high. 53% of Americans are not confident that they can tell a deep fake, nor can I. And I bet everybody, all the professionals that are with us today can't either. And 60% said they'd like more control over how AI is used and they don't want it to govern our lives. So when you're talking to patients and you're using the next big AI thing, this is the sort of information that you need to have in your back pocket. There's some people you'll be talking to who don't know really anything about AI. And there is some research coming out now, obviously, particularly with generative AI. It's so young that we don't have any good research. But we do know that if you write things down instead of typing it, you remember it better. There is some research that says that undergraduates who use only AI to help them do their research and write their papers actually are illiterate at the end of their degree, their undergraduate degree, in the subject matter itself. And so that's of huge importance for us. There is a study from MIT that showed that when you use AI, you are not engaging with the material and understanding the material in the same way as if you were doing your own research. And there's a brand new paper from HRB which shows that that businesses with either lazy or overworked people using AI and end up with beautiful presentations or beautiful papers, but somebody along the chain of receiving that within the company has to spend up to 1 hour, 57 minutes actually making it useful. So these are some of the big problems that we're already seeing beyond the big problems of bias and transparency. Somebody earlier actually asked about the planet, and I can tell you that Eric Schmidt said that by 2030, AI would use up to 95% of the current global energy on the planet. Every time you ask a GPT, so one of those generative AI models, you're using a quarter of a liter of water. So I tend to ask it important questions. And we are already seeing it overtaking the aviation industry for global greenhouse gases. I haven't got much time, so I'm going to move on quickly to hallucinations. Hallucinations are where the AI simply makes stuff up. It is significant in law at the moment. We used to think it was only in the open models like ChatGPT, Claude, etc. But we are now finding that even in the proprietary models that have been created specifically from lawyers, we still have hallucinations as to the titles of the cases, the scope of the cases, the facts of the cases, and the decision of the case. That's hugely important for us to think about when we're thinking about research, when you are thinking about, well, how do I use this in medicine, even if you've got a proprietary tool. Just recently, Deloitte delivered a paper to the Australian government, and they found the Australian government found hallucinations in that Deloitte paper. What happens then is that Deloitte paper is in Deloitte's proprietary data collection. And so unless it's weeded out, then an AI using that data will be able to find it and repeat the mistake. And I don't pick on Deloitte, it could have been anybody. And it is almost certainly everybody. And that we call cannibalism. Deep fakes and the rule of law. My lawyer boyfriend is a case that I heard of recently from a colleague of mine who said, whose client said to him, my boyfriend says that you're wrong. You're giving me the wrong advice. Well, he asked, who's your boyfriend? And the boyfriend was ChatGPT. The person had put all of the court cases, including the other side's confidential documents, into an open AI ChatGPT. So the consequences of this are massive. And if you then think about your patient putting all this stuff into an open model, all of their medical records, etc., you can begin to see the problems. In law, we are also seeing deep-faked evidence, for example, medical reports in person injury cases. And I think that this comment by the judge is so absolutely pertinent for our time. And of course, we're told that everything will be better because of AI, but I think we need to stand back. Yes, maybe the world's economy, but we've not yet as humans, I think, defined what is better. Is it how much money we've got? Is it that the economy is abundant rather than scarce? Is it human well-being? Is it a healthy planet? Or what? And the other thing that I want to very quickly, and I know that I'll be out of time, talk about is that the CEO of Anthropic says that entry-level white-collar jobs will be overtaken by AI, so humans won't be doing these jobs. But in the light of what I've just said, maybe we need to rethink this until we get to a point where actually AI can do the job as well as we can. Which brings me to my question. are there any human-only jobs? And as somebody who suffered from breast cancer and enjoyed fabulous human doctors to help me with that journey, I would say oncology was one. A doctor, a surgeon wrote in the New York Times last year that actually anybody, including an AI, could tell somebody that they're dying. I personally think that that's a human-only job. So finally, there's so much to question. I too have a book, but it doesn't come out until January. But I really hope that this is a good guide from the three of us into the sort of things that you need to be thinking about. And I look forward to our panel. Thank you.
Oh, wonderful. Thank you so much, Kay. Also, for reminding us that humanity is really at the central part of this, including how we interact and use AI. Thank you for introducing also really important point around sustainability as the AI economy gears up. Making sure that we're really thinking about accuracy and hallucinations as an important aspect of how and when and where we deploy AI, and of course remaining grounded on what's better, what is the problem we're trying to solve through this technology. So if I could ask Suresh and Nicole also to come back on camera, we'll dive right into the conversation part of this. So thanks to all three of you for such fantastic talks to get us started. As you've seen from the comments and the Q&A, there's no shortage of really interesting points and where we could go into. Let me start us with stepping back and really thinking about what this lecture is about, and that's around the field of public health. And we're in the midst of profound changes to the field that includes especially the erosion of trust. Trust in public health, trust in science, trust in institutions driven by so many different factors. And in that, of course, we're seeing the rise, as you've all talked about, of AI. And I'd love to start chipping away at this intersection between the role of AI and the way that it may impact this issue of trust in public health in both positive and in negative ways. And Nicole, let me bring you into this conversation first. In your work, how do you think about the ways that AI can actually help us build trust in health and healthcare, especially among medically marginalized populations?
So this is such an interesting question, and I will be sure to share with people, or you can go to my Brookings webpage or my personal webpage. I wrote a paper on whether or not AI could actually substitute the public health workforce, and the extent to which, with some of the challenges that we're having with this particular job that has high burnout, high stress, could you actually employ AI to sort of assist with augmentation of their roles or complements of their roles, etc. And where I landed, which is where I land with many groups that are medically marginalized, for example, is to, I think, Kay's point about going through cancer and having the caring human approach as part of this. So AI is not necessarily going to build the type of trust that we already know is essentially not there with certain groups. And so I think we need to move that narrative out of the way, because it's sort of misinformation if we think that it's going to positively impact our relationship with patients or people who choose not to seek care. What we found with the paper that I wrote is that it can do other things like professional development, or it can help with scheduling and patient management and productivity. But when it comes to that one-on-one relationship, there is a process for building that trust. And we just put out with one of our non-resident fellows at the Center for Technology and Innovation, a podcast, and we're about to release a paper where this particular fellow researched how Black women actually interact with AI. And the finding, which I found to be so fascinating, was it was not so much that AI could not assist Black women in their health and their employment and other needs, but their lack of trust in those institutions really deterred their faith in the technology to work. So I'll just end here. I mean, I think it's really important for people to understand that AI is not going to replace the entanglement of how people actually interact with institutions that are already before them. If anything, it can encourage it in some way if the AI actually works well. In other ways, it can actually discourage or sort of feed into what their current relationship is with those institutions. So we have to remember that we do need a healthy ecosystem already before you start inserting technology into the mix. And I think that was the premise of my colleagues. And it must be very participatory because many of these products and services that are being developed as well are not being developed by people with the lived experiences of this group. So I'll stop there, but I'll share that research we've been looking at. But it's a fascinating space as to whether or not many of these carrying economies can actually use AI to build something that's been, systemically a long time in the works, in terms of trust and relationship.
Yeah, thank you. I think an important reminder that any technology, certainly including AI, isn't going to reverse other underlying trends, and is many times reinforcing of those trends and helping them go to scale much more in whichever direction those trend lines go. Kay, let me ask you, how do you think about this issue of governance and the way that it ties into trust, not just in AI as a technology, but in the way that it's applied and ultimately the field that it's supporting, in this case, public health?
Yeah, absolutely. And as the world's first chief AI ethics officer and spending all my days helping companies think about governance, I would say this, wouldn't I? But governance is the way to trust. If you offer if the people who you are working with know that you have thought through all these different challenges, then they're much more likely to trust you. And so I actually now find myself saying to businesses, well, it's just a wise thing for your customers, your employees to know that you are governing well. And when you think about that Pew Research, and there's a lot of research out there that shows that so many people really distrust this, then if you're going to use it, you have to build the trust in some way. So you have to be able to offer your patients that level of understanding of how you're going to use the AI and why you're going to use it. So I went to the doctor recently, and the doctor said, I'm going to use AI to take notes. Is that all right? That was it. They didn't explain what AI was, and I might have not known what AI was. They didn't explain anything about how it took the notes or what it did with the notes or anything. And of course, I, being me, said, well, I don't mind so long as you make sure that you check the notes, because if the notes are wrong, that makes the whole conversation that we're having about my health wrong, and in an ongoing fashion. So I think there are some things that we need to think about. As I say, one is public adoption and public trust. And the other day I was in the toilet in the ladies' toilet in an airport when I could hear this woman in the other cubicle shouting down the phone, I just want to speak to a human. And I think that's, in fact, United Airlines has now said you can speak to a human in their branding. So I think what we have to do is really make sure that we understand that we might be here where we think about AI, but our patients are here. And so we've got to bridge that gap. Training the employees is so important. All employees working anywhere with AI need a 101 on the benefits and problems of AI. You don't want people bringing in their own devices and asking medical questions of an open AI that might have the wrong information. And obviously testing, red teaming, all of these sort of things. But I want to just finish with something that Nicole was saying, and I'm saying, the public don't trust this, but actually some of the public do and are turning to it. So just 3 stats. One, the largest group using ChatGPT are white men in America under 46. there is research that shows that 20% of white men living in America are using AI as an intimate partner. And there was just something published yesterday, and I can't remember where it was, that said 1 in 5 school children had AI as a partner as well. So generationally, maybe the trust in AI will change, but at the moment we're definitely not there, and we should not be there, and we should be really frightened about those statistics.
And hopefully, Krishna, we can get back to that point too, because I do think it has an application in the medical field. So just want to.
Absolutely. Let's do that. And Suresh, let me bring you into this conversation as well. You talked a lot about the approach to evaluation and that community-based piece of this. How do you see that really aligning to the issue of trust and what comes out of some of these tools and the way that that approach you laid out might help us?
Yeah, that's a great question. And I appreciate all the comments from Kay and Nicole earlier about this. There's something very interesting in the way we talk about trust with AI tools. First of all, we talk about AI as a kind of a thing that we have to build a trusting relationship with. And I think I have come to reject that idea entirely. That is not the point of, that is not what we should be asking for or demanding. Rather, we should be thinking about who's building these tools, what they're offering us. I don't have a trust relationship with a hammer. I hope I don't. I don't have a trust relationship with my microwave. I don't have a trust relationship with my Swiss Army knife. I use them for specific things. I understand where I can use them, and I don't need to use them for all kinds of stuff. The problem with AI is that we've been sort of depersonalizing the active role that companies are playing in constructing a vision of AI, the sledgehammer vision, and presenting that vision to us as the only thing we have available to us. So it's a tool, it's a thing. We either have to trust it or not trust it. If we don't trust it, we're kind of Luddites. If we do trust it, we're falling into the hype, and that discussion doesn't go anywhere. The reason I think community-driven evaluation is important, and it's because I've come to believe this more and more, is that it allows us to figure out on our own terms what kind of tools we want to solve what kind of questions and how they can help us. If you ask healthcare professionals, if you ask people working in public health, you ask those going on to communities to talk to people about vaccinations, what they need, I doubt they're going to say, we would love to have an AI to replace us. I think what they want is help. They want resources. They want things they can use in their own work. And if we were to ask them what they wanted and try to build things for them, they would the question of trust would not come up. They would just be using tools that they actually wanted to use. And that's why community-driven ways of thinking about this are important. But as a computer scientist, right, who thinks about how to build these technologies, who thinks about how to reimagine and redesign these technologies, and who is confronted with the hype that we're seeing from the companies who want to present one tool to solve all our problems, it just makes me very restless when I feel like, well, that's not what I wanted. Make me something different that I actually care about. Or as a computer scientist, I can help you, who wants this tool to build what you want in a way that is on your terms. And that's why I think community-driven evaluation is so important, because it opens up that discussion in a way that we've been unable to open up because we're sort of stuck with the binary of either you embrace everything that the tech companies offer you or you're left with nothing.
Yeah. Well, thanks very much. Nicole, you want to jump in?
Yeah, I do want to respond to that. So, Suresh and I know each other quite well. I want to push back on one point of what you said about trust, though, if you don't mind.
Oh, I don't mind.
So I do believe that people don't sit there and say, I trust in my microwave, right? Like you said, or I trust my dishwasher. What we do trust is that it's going to work like a microwave. And we trust that it's going to work like a dishwasher, right? And we have a history under regulatory approaches where we have the Energy Star rating, for example, which I write a lot about, where when you go into a big box store, you see that big yellow sticker and it says this has been tested by a collaboration of consumers and civil society and industry. And it's going to give this much water. It's going to do this much electricity. And I think to your point, I think people want to know that there's some level of trust in design. There's some trust, like you said, in terms of who's making it, but most importantly, that there's some trust that it's going to do what it says it does. So I spent a lot of time with facial recognition technologies, for example, like many of my colleagues and you both, right? I want to trust that when I use it, that I'm not going to be misidentified as a criminal simply because the technology itself is not optimized to see darker skin hues or to mismatch the face and the detection part of it. So as a result, I now have used a technology that has taken away my trust, that I can actually put this in my house and look at surveillance of people who might be robbing my house. You know what I mean? So I think I get what you're saying. And I think for people here, I think it's the same thing in healthcare. We trust that our doctor is going to do the right thing, but we also trust that they're going to use the right scalpel and telescope and other tools that are going to help us in our recovery. And I think that for medically marginalized people, trust is a huge factor. And when you throw in AI and you tell people, oh, I'm going to take notes on your condition, and they don't know, like Kay said, what the notes are. And then somehow somebody else gets the notes and they forgot the AI transcription was wrong. Now I'm getting the wrong medication. There are too many stories like that. My dad was diagnosed with prostate cancer. He ultimately died of stomach cancer. And when we have those fractures outside, we have to demand from the technology that it's maybe, Suresh, to your point, it's not trust, but it's trustworthy. And I think that's the area in which we all struggle with. Like, how do you make this a trustworthy, contextualized technology that people can say it did what it was supposed to do? And I can actually vouch for that technology.
So if I can, I agree with, I mean, you make very
Spoken
good
by a
points.
true sociologist, by the way, for everybody listening. I'm the sociologist.
I mean, you make very good points. And I remember being at an event where, we were talking about AI regulation and AI governance. And the speaker sort of looked up at the stage and said, we have these light bulbs on the stage. We have this building, we have this construction. And we trust that all the building won't come down over our heads, that the lights will still work. And we trust in that, again, not because we trust in electricity or we believe in physics, but that we know there's a regulatory apparatus, there are inspectors who come in, there are standards.
That's right.
And I want to bring this to another point, right? There's this big debate right now, or at least there's a debate about AI regulation and what we should do. And there's a lot of people, especially in the tech industry, who are arguing that we need to stop regulation, not do any regulation of AI, so we can innovate. And I think we forget, or they want us to forget, that for every single piece of tech that we use in our house, our medicines, right, our drugs, our cars, our consumer appliances, they have been rigorously tested over and over and over again. And that's why, as Nicole says, we can trust them, not because we trust in physics or we trust in science, but because we trust in the process, right? And so we need that for AI as well. And I have to say right now, there's a lot of push to stop doing that for reasons that just totally make me aghast and sort of make me very scared, but are not based on actually thinking about the science.
Absolutely. And just to follow up with,
and Kay, I want to come to you on this, especially because I think AI, as we see with many emerging technologies, we often see this tension that on one side, we need regulation to protect public safety and ensure trustworthiness, and on the other, the room to innovate. And we've seen with AI, very different approaches from the US, for example, than Europe. And what you're seeing is massively more investment into AI and tech development in the US, perhaps partially driven by a difference in the regulatory regime that's opening up more innovation and perhaps less trustworthiness in the US relative to the European context. So, Kay, what's the role of government here? And if it's not government, what are the other ways that this type of trustworthiness can be built? Is it self-regulation, which hasn't traditionally worked well in other industries? Is it something else?
Yeah, well, I mean, I was, thank you for that question. I was going to come in and say, actually, some of the places that we do see that AI is deployed better in the companies that I work with is in companies that already understand regulations. So financial services, for example, and healthcare. The willingness to take chances in AI is not as high where somebody understands regulation. And so I do feel that there is some self-regulation. There is also more self-regulation now because most companies, not the AI companies, but the companies who use AI are all worried about how they deploy this thing that now has showing that there are problems with it. And so without government to help them set up frameworks and things like that, they have to set up their own frameworks, which is why I'm not out of a job. And so some of them just use the EU AI Act as a baseline, and especially those that are trading with Europe and have got to anyway. The Colorado AI Act actually looks almost identical to the EU AI Act, and although it's been passed, but it's on hold at the moment whilst they review it. Some companies are using that, and although we think that there's no legislation in the US, actually there are large numbers of states which have legislation and regulation in place. And so it's actually for companies, it's a bit of a minefield and a bit of a, well, I trade with this state and that state and that state, so how am I going to do this? Which is how they come to saying, oh, well, we'll just use the AI Act because it will cover everything and not just human resources or whatever. I actually don't think it's about whether there's regulation or whether there's no regulation. I think that there's a lot of innovation here because there's a lot of money here. If there was as much money to invest in AI in Europe, I think Europe would be just as far advanced as we are. It's just that the investment, the huge sums of money that we're seeing are located amongst businesses based on largely on the West Coast. One thing I will say is that with a lot of companies, and I think particularly in healthcare, if you do one deployment well, it gives you the courage and the knowledge to go on and do another deployment well. Whereas if you just fling AI at the whole of at every employee in the company, you are going to have problems. And unless you have good guidelines about what they can do with it and what they can't do with it, and that they can't bring this device in and use it, you are going to end up in a court. And that's not good for anyone.
So, Krishna, can I add a thought to this, to Kay's point? I just want to say that every time I hear the word self-regulation and AI agent gets its wings and starts fluttering, so when I was in the Biden administration, when we were doing AI policy work and we were developing the blueprint for an AI Bill of Rights, we got a lot of conversations with companies and who spent a lot of time telling us how they were doing self-regulation and how we didn't need to put out any guidelines because they were doing it all themselves. You know, we listened to what they were saying. We tried to understand where they were coming from. I have many colleagues who work in these companies and who were telling me about what they were trying to do. And we said, okay, that sounds, we should work together to see what we can do on this front. Let's see what you can do and let's see how you can regulate. The minute the administration changed, most of these companies completely abandoned their efforts to do any kind of regulation of AI, and it was all innovation full speed ahead. The Colorado AI Act that Kay mentions as this legislation, she mentioned it's been on hold for 2 years. Let me tell you why. It's because all the tech companies have been lobbying for 2 years to kill it, whilst pretending that they want to go ahead with it. They do not want regulation at all. Okay. And the legislation across the states, there are about 1,000 bills that are in process at different states for the last 2 years. We've been studying some of this. Only Colorado had passed of all of them, and that's on hold right now. There was a comprehensive bill in California that's been come up for review 3 times and has all 3 times been rejected by the governor or in the legislature. There have been smaller bills on AI companions and AI therapists that have been focused, but nothing on the kinds of comprehensive legislation that we're talking about here with health. Companies do not want AI regulation, even if they say they do, and that's why it needs to come from the outside. They are welcome to put in their own standards. They're welcome to do in their own best practices. That's great, and they should do it. but let's not pretend that we can expect companies to do this on their own. We need something from the outside, otherwise they're not going to comply. And I used to not think this way, but I've seen this change very quickly happen, and I've changed my position on this.
So I want to
Good.
just come
Nicole.
back on that because I agree entirely. And that's why I made the differentiation between the AI companies, the producers of AI, and the users of AI. And I agree that everybody should be regulated, but particularly there is a difference between attitude of those people who are producing AI and those people who are downstream using it.
Right. Yeah, I mean, I was going to add on this conversation, which I think is fascinating, particularly as we present it as part of the Bicknell lecture. I mean, I think that there is this counterpositive between innovation and regulation, and people seem to think that you cannot do both, right? Because as Kay said, in the European Union, and China, as a matter of fact, it also has AI regulation. There's this idea that you will slow down and walk cautiously, and you'll stop the next big idea. But as I do in my work, I mean, I think the part of regulation that sort of complements innovation is that you're controlling the trade-off. Regulators are in the business of protecting the public interest. And so what that means is they're protecting the public interest around, is this particular AI tool going to have any type of recourse or consequence for people who rely on it in healthcare? We already know in healthcare that we have existing statutory requirements and laws. Those don't go away, but it makes it very unclear in the AI space because of the use of proxies, because you're not necessarily using race or location. You might be using the amount somebody pays in hospitalization, which didn't work well for one company when they used that because they were disproportionately impacting other folks. The question becomes, how do you get regulators to sort of understand that they don't have to know the ingredients of the black box? What they have to know is what's the consequence of the AI on the everyday person. So I do think that there has to be a conversation shift as well, so that you begin to tell people that they can actually coexist. I also want to say, since we're talking about policy, particularly for those on the webinar as well, and kind of going back, Krishna, to this conversation on regulation, I do agree that self-regulatory frameworks, they're more, window dressing than they are actually substantive. But I do think there's something else too about also being cautious about the government when it comes to AI and healthcare as well. I mean, there's a recent announcement in this administration of the move towards, for example, wearables and digital health tools that people can actually track their health cadence. We have to be careful when it comes to that, because the biggest legislation that we lack in the United States is privacy legislation. We don't have comprehensive privacy legislation. It's not so much, what if I have that wearable and all of a sudden I'm not getting my steps in? So it's not so much my doctor's going to be mad at me, but so will my health insurance company. So will my underwriter. So will these other people. And so government medical surveillance is also enacted when we actually place these tools in the hands of government who hasn't really decided on the regulation that we need to do to protect consumers. Again, government plays well in protecting the public interest, and that's an area that they continue to not actually go towards. And the last thing I would say, and this is actually the focus of my book, none of this can happen with your patients unless they're connected to the internet. I continuously tell people, I'm so excited about AI and the possibility of compute power and what we're going to be able to do. I mean, on the one hand, I tried to be Debbie Downer for many years. Sometimes, I don't know, Suresh and Kay, I got to come on the other side every once in a while, because I have seen some really interesting AI tools that are helping people with the social who are impacted by health disparities. But at the same token, it's really important for us to recognize that much of what we're asking people to do, everyday patients to do, means that they have to live in areas with high broadband access. Rural communities may not be able to benefit from AI in the ways that we think they can. Some urban communities with a lack of competition, potentially not. Families that are already distressed in paying their services, are not near any type of fiber connection, another problem. So we have to be cautious. Again, I go back to that word ecosystem, that we're placing AI in healthcare in a very livable, sustainable ecosystem, so that we don't place expectations on people that they cannot fulfill for us.
Oh, thank you. And sorry, just to keep going down this road just a little bit, I think just to note, if there could be a strong role for government and regulation, as we've pointed out, but trust in governments is also quite low. And so thinking about the role of government, and if there's not a trustworthy government, which we're seeing all around the world, right? Or governments that are not mature enough in their policy framework, especially for a lot of us that work in low and middle income countries where the regulatory framework perhaps just doesn't exist, much less enforced over time. So thinking about other actors and how this can happen in a more collaborative environment, I think is going to be really important for how this field moves forward. But Nicole, you mentioned this issue of privacy, and you've talked about data before. Let's take a bit of a dive into this side of things. All of this is built on data. And so what needs to happen to create a more responsible approach to the data environment and the data infrastructure that then can feed into an AI economy appropriately?
I'll kind of mention it. And so just so people know, the AI Equity Lab started like workshopping 10 different things. And my particular interest right now is in education and healthcare. So I spend a lot of time with healthcare people because I just find this area to be one of the most consequential outputs that we'll have because it affects a lot of different things for people. So data obviously is the currency for AI. And it's not necessarily, as I know Suresh is going to hate that I say this word, but it's not good data. That is the currency. It's all data that companies can get their hands on to train these models. And for people who are less familiar with the artificial intelligence space, it's not just data that allows for predictions. It's also your voice, it's your face, it's your text, it's your language that essentially happens. And what happens with these models that we've been talking about, these 5 to 6 companies that are controlling the world right now when it comes to artificial intelligence, they're building these very large language models, which means they have to feed the beast. And that means they have to give more and more and more data to that. I had the opportunity to hear Karen Howe in Amsterdam just a couple of weeks ago or last week. And she brought up a point that I hear from, and I'm glad you brought up, Krishna, the international context, because I hear it a lot in our global South work from the African Union, as well as India and Latin America, that maybe we need to look at what's called small data. Small, deliberate, cautiously curated data, particularly in healthcare, where we can account for some of the predispositions to disease that happen close to the equator versus those that may happen in a different climate when it comes to people and potential patients or people who might be subjected to certain disease. I think that's an interesting way to look at it. And it kind of debunks the model that all data has to be big in massive forms of collection, etc. There's this other thing that's happening that I think is important for this community to know as well. We are finding, and I like how Kay kind of poses this as well as with the business community, we are finding small startups and innovators that are beginning to look at ways in which you collect data that makes sense for different sectors. So I literally just sat on a panel with a woman who worked at the Gates Foundation. She was a fellow there. She's developing a company that's looking at healthcare data, and they're ensuring that it's inclusive and it's representative of different types of, predispositions, that it's something that, they can authenticate and validate and they can audit. These are small companies that are essentially feeding larger companies or universities with regards to that. So I do think, Christian, to your point, there are lots of challenges in collecting data based on who's collecting it. It's lots of challenge in having it representative. But I also want to bring this out as a last point, though. I think we have to be careful in the health space to sort of recreate the same type of models that we have done with clinical trials, where we compensate people for their data. I think that's also one of those areas which I always cringe at, because in our rush to get data, we also think that, well, maybe we should just oversample and include more people and give them $50, which some of these small data companies do. But when you start getting into health, if hospitals, large medical institutions were to do that, there are lots of liabilities and risks that come with that. In addition to the fact that you're now incentivizing people to give up something that is personal to them without the appropriate guardrails. And so this kind of goes back to the regulatory question. There's regulation at government, but there should be regulation at your institutions, quote unquote. There has to be, as Kate said, soft and hard guidance. red and green lines, which allows you to work with many of these companies externally by asking the right questions. I think in the chat, somebody said, what questions do we need to ask? But it also allows you as a hospital, if you want to collect consumer data to be able to build an AI model or system, you also have to do the research and you have to do the grunt work to do continuous oversight to ensure that people will not be harmed. And so at the end of the day, for me, it's a question that we're not going to be able to solve. I've been trying to figure this out with a lot of people. How do you solve the fact that there's no more data? And then I wake up from a hot sweat thinking about Henrietta Lacks and the Tuskegee experiment and other people whose bodies have been used and exploited without them knowing. And then I say it starts with, again, like Suresh said, participatory engagement so that you actually get the right people at the table who come with the care and knowledge and human oversight. So we all got a lot of work to do, and all of you on this call as well. But it's worth pointing out, I know my colleagues feel the same, but I've been noticing that in this data conversation, that it's beginning to look more smaller than larger when it comes to the implementation of models.
Thank you. Kay, let me bring you into this conversation around data and then Suresh as well, but maybe add to this context also that the good actors, so to speak, are the ones being left behind because there's a lack of strong rules and regulations. If you want to do something, you can. And so we're seeing mis and disinformation spread wildly while those of us trying to curate very good information around health and public health are doing it in very small ways. So how do we also account for, strengthening the data environment in a place where there are not guardrails for all actors who want to move as quickly as they would otherwise? Kay, your thoughts on that?
It's really hard and I would say almost impossible. I see, yeah, and I see my fellow panelists agreeing. I just want to, I think, to add on to Nicole's point about access to the internet. When we think about serving people in the global south, 2.6 billion people are still not connected to the internet. So, I hear people wildly saying, oh, we'll be able to use AI to stop women dying in childbirth. No, you won't, because the majority of women dying in childbirth haven't, there's no connectivity. So one of the big worries for me as we think about public health is that split. We're seeing the split within the United States and other countries between those who have good access to the internet, and Nicole talked about that earlier, and also internationally as well. I think that we absolutely have to have good data protection rules, and we don't, and we won't. And until we have those, we won't cure the misinformation and disinformation. And we can see the results of that with the measles epidemic.
Yeah. Suresh?
Yeah, I mean, it's tricky because I think, as we're seeing these conversations go from AI to data to the global landscape, they start to feel increasingly intractable. And I think it can be frustrating to have to think about how all these things are connected together in one gigantic hairball that we can't disentangle. And so I would like to offer, maybe a hopeful perspective on all this, right? That let's go back to Nicole's point about small data. A really excellent point, I think, about the value of small data. There was a post of I think yesterday, which is 10 years ago in internet land, but yesterday on a new tool for building a small language model, which is like 8,000 lines of Python code, maybe training for about $100 worth of compute time on a node you can rent from AWS, and you get a model that's halfway decent, quite reasonable. This is not something we would have been expected to be able to do like 2 years ago or 3 years ago. The fact that we can do that now, it's possible to do that now, means that there is innovation, and I'm going to use the word innovation, in building smaller models that use less resources or that use much more target resources. Another point, I'm hearing more and more from people the following. Yeah, I used ChatGPT. It didn't really give me the answer I wanted, but this company built this very specific customized model for my use case, and that seems to work really well for me. even though all these chatbots don't work well. I find that very encouraging that people are thinking now to build specific boutique, if you wish, artisanal models, if you want to call them that, that work specifically in use case, which is where I think community-driven evaluation comes into play again, where you can actually see benefits without having to amass everyone's data, without having to do all kinds of surveillance. And I say this because A, it's happening and it is innovation of a real kind. And it is something we can ask for and we can demand. We don't have to take for granted that the only tools available to us are the ones that require web scale, data scale, that have to be Western oriented, that have to be in English because that's all the data we have. We can demand more and ask for more, and there will be companies and researchers who will give it to us. And I think that's where I feel very hopeful that by people saying, no, I want better, I want a better model, I want better tools that do what I want, someone will be out there to give it to you. Maybe it's a 15-year-old who's looking for a new project somewhere who will be able to build that for you. But they can do it. And that's where the real innovation will come from. And that's where the new ideas will come from. And that gets us out of this trap we seem to be in right now with data and AI and so on.
Yeah, wonderful. Anybody want to add on to that?
So you just had me think of this conversation I had just recently about criminal justice data, right? And so it's the same, you could probably take healthcare and put in criminal justice, financial services. And we were talking about small language models, and we're like, wow, this particular person has done 20 years of work with the justice impacted community, and was like, do you know how much great information I have from, when people are incarcerated to when they leave? But she said this word that I think is important, Suresh, to kind of add on to what you said. She said, I have values-driven data. Meaning, when I think about this data, I give it this care because I am close to this community in so many ways, personally, professionally. And my data reflects questions that would never be asked for someone who doesn't know that. So it goes back to what you said, this participatory model, which is why, again, I did the equity lab, and Suresh has been working his group, and Kay knows this. All of us, I hate to say it, we're kind of the OGs who've been watching this thing for quite some time. This question of values is one in which has not fit in this Christian and here squarely into the responsible, trustworthy, ethical naming and narrative that we put out about AI. And I think that's where, again, people are becoming much more reasonable to question this technology and to say, do I really need this? And I think Kate's point, if we can go back to the character AI, we're now starting to see groups resist the fact that we have to live in this world, where we cannot be Luddites. And I think that's a question, with any type of technology. This is not new. We've seen this over the course of generations when a new technological revolution happens in our country. But it also suggests when we find ourselves stuck, do we not only know that we have agency to say no, but do we also know how to get out of it? And that's the only thing I would say to my colleagues. I don't know if they want to take this on. Character AI exists because we live in a lonely society.
Mhm.
Doesn't exist because people found more empathy and partnership. It's because we live in a society where people feel disconnected, unloved, and alone. And so technology in many respects is building off of our fragility.
Yes.
And that's a question for those of us in the health space have to continue to think about. Is this a tool that's going to help me be a better physician? Or is this a tool that's filling a blank of something that I need to be doing in my role, to enhance the human experience? And that's something I think we need to teach medical students early on who are enticed by going into AI and using it in these spaces that require the human experience.
Yeah, and I'll just add on to that. I mentioned my breast cancer experience. When my oncologist found out what I did, she said, "Oh, wouldn't it be amazing if we could have AI help you with your journey with breast cancer?" And I looked at her and I said, "I think it'd be better if we could get AI to help you with some of the tasks that you have in your back office so that you, the human being, can walk me through my relationship with cancer and my cancer journey." So for me, it all comes back to that first slide of mine, humanity. Let's put we're told that we're in the age of AI. I'd like us to think about we're in the age of humans, and we have this tool called AI that may be able to help us if we use it wisely.
Oh, that's wonderful. We're coming up to the end of our time. It's been such an amazing conversation. We've gotten so many great comments and questions. We've incorporated as many as we could into this discussion as well. Let me ask you to think about maybe a final thought that you'd leave our audience with, and maybe to put some focus on it. We're here with the School of Public Health. Many of you work with students and young people all the time as they're thinking about their careers in an AI economy, their role as students. What's a message you would send to them about what's most important to hold dear, what's most important in terms of the opportunities as they think about what the future actually holds here? Suresh, I'm going to start with you.
So the thing I always tell people, which sometimes comes as a surprise after what I've said before that, is, these are fun tools to play with, and you should just embrace them. You should play with them, not because you're either giving into the hype or you're a sucker for the technology or whatever, just because they're fun to play with. And when doing so, you will learn just to have your own relationship, if you wish, not in that sense, but sort of your own way of interacting with different kinds of tools, seeing where their warts are, seeing where they're helpful. There are times when I use these tools a lot, for example, for writing like small snippets of Python code to make some graphs to settle arguments with my friends about sports statistics. It's a great use case. It works very well for me, and I win the arguments, most importantly. But anyway, I have learned over time how I can get them to work and where they don't work as well. I have built that understanding. It's the way we've built understandings with a lot of the tech we use, whether it's search engines or maps or whatever, right? I think people should not feel at all hesitant to do that. That is separate from thinking, and that'll give you a much more informed perspective on, in your own domain, whether they make sense to be used in your domain or not, and where they can. Otherwise, we're stuck, I think, still having conversations at a level which is not informed by actual lived experience with the tools. And we can have that and have that more informed conversations. That's what I would say.
Thanks so much. Nicole?
Yeah, I mean, I agree with Suresh, although I don't play with the tools because honestly, I don't know how to use them. So, and both of my kids are in college and graduate school, so it's just me and the dogs, and they can't seem to teach me. So I do agree with you. I mean, I had this experiment I was running, which I was telling people I'll never touch a chat bot. And then one day I couldn't get a book at Barnes and Noble, so I had to go to a chat bot to answer this really simple question. And that works for me. I use AI not to replace or change how I write my sentences. You all know what I'm talking about, but I use it when I'm actually looking for something very discreet. And I think it goes to Suresh's point and Kay's point. Use it the way you see fit. But I do think, and people are putting this in the chat, and this came up on my panel last week, we need a frame for how we're teaching medical students on how to use this technology. We need one track that's around the productivity and efficiency side, and we need to have that track. There was an article in the New York Times that said the AI transcription of a medical visit of a patient still landed up with him as a fatality, as a fatality, because there was a misread of the notes based on the AI transcription. So we need to teach people that these tools exist, but we also need them to be great interrogators of those tools as well. And then I think, honestly, and I've been saying this for quite some time, I'm not a practicing doctor, I'm a PhD in sociology. There are differences that exist among various healthcare subsectors. So I think gastroenterologists need to have a different conversation than people who work in heart health, than people who work in radiology. And I put this out to the Cardiology Association that I spoke to on Friday. They should go to the Heart Association, the American Heart Association, and say, we need guidance. And here's some things that we think need to be in this broad stroke guidance on AI's application in our field. When it comes to, thinking about the condition of the heart, thinking about the radiology imaging, thinking about those kinds of things. And we need to do the same thing, Christian, with public health. I think this has to be a bottoms up conversation that disrupts the power dynamics of who's telling us how AI is going to help us. And I think if we actually do that, we might get a little further to have more agency. But when it's all said and done, we also need to teach medical students that if you don't know how to use it and you still want to take that telescope and carry it around your neck and put it on somebody's chest, do so. Because I think we're sending the discussion, we're sending the notice that this is the way of the future of medicine. And it may be, just like, We didn't know that we were going to have digital health records, but it may be something that we still do in a calibrated and thoughtful manner within our sectors itself.
Thank you so much. Kay?
Yeah, so I think I agree with Suresh, but use it wisely, I would say, because there are true climate problems here at the moment as you're using it. I think that as humans, the one thing that we need to do is think critically about these tools, both the way that we use them in our homes and in our own lives and in our practices. And use your own intelligence to think about whether this particular tool is going to make your practice better for you, and perhaps more importantly, better for your patient. Is it going to improve patient outcomes? If it's not, then probably don't use it.
Yeah. Well, fantastic. We could keep this going all afternoon, but unfortunately we're out of time. What an amazing tour de force we've had from the three of you. We really started a conversation around technology and ended the conversation around people and humanity. And so often when we see technologies that have transformational potential, there's this tension that we've all talked through of how do we use it for the best possible ways while we're managing the risks. And so how do we think about the interaction between the technology and people as the path forward? How do we make sure that we're creating the guideposts and everything from the right evidence and the ways to generate evidence, the ethical and responsible development and use, the issues around bias and transparency, certainly around sustainability of an AI economy going forward, and what does that mean for climate and also for jobs in the future? And of course, equity and fairness and access to these tools as they develop over time. We heard about focus on use cases, thinking about making sure we're developing better tools for important cases as ways to improve health, healthcare, and public health going forward. And most of all, we talked about how to make sure that this can really be grounded in the community and grounded in the values that should really be driving the path forward in the field. So let me first thank Nicole, Suresh, Kay for your expertise, for your time, such fantastic perspectives to make us all a little smarter through this. A huge thank you to the BU School of Public Health, the Center for Health Data Science. Hopefully we've honored the legacy of Dr. Bicknell with this amazing conversation. So thank you all for this opportunity to be here, and I'll turn it back to Dr. Debbie Chang to close us out.
Thank you to our moderator, Dr. Uday Kumar, to all of our speakers, and to everyone in our audience for joining us today. We hope this fascinating discussion inspires continued conversation beyond today's lecture, and that Dr. Bicknell's vision continues to guide and resonate as we explore bold ideas in public health. Please be sure to register and join our next and final online conversation of the semester, Public Health and New Media, Modes of Persuasion, co-hosted by the BU College of Communication and Public Health Post, taking place on November 12th at 1 p.m. Eastern. Thank you.